update in former President Joe Biden's health battle. A spokesperson telling Fox News he is undergoing radiation therapy and hormone treatment. The former president was diagnosed with an aggressive form of metastatic prostate cancer back in May, with his last known prostate screening dating back over a decade ago. Emergency medicine physician Dr. Owais Durrani joining us now. Dr. Durrani, what do you make of this development?
Yeah, thanks for having me. So this is a very common treatment when it comes to prostate cancer. When we talk about radiation therapy, the reason we avoid radiation in our everyday lives is it leads to DNA mutations. That's why it's used in this situation. Basically, you point the radiation towards the cancer, it damages the cancer DNA cells and prevents it from spreading and leading to other issues.
And, you know, as we send our thoughts and prayers to the Biden family, he is obviously older and we've seen challenges with health. You know, what do you make of the fact that this might have been not detected early enough?
Yeah, so it's a bit of a complicated question. Usually prostate screening and exams are recommended when you hit your 50s, and they're quite common when we're on our 50s and 60s. The guidelines say after the age of 70 for kind of the mass population that there's generally no need. Now, obviously, that's a very personal decision between a patient and their doctor. And so it wouldn't be unheard of to not have had your, exams and levels checked throughout your 70s. But then again, when you are an executive of that level, I imagine that conversation is a little different. So hard to know exactly what went into that decision. But for an average person, I would say it's not unheard of to not get those levels checked in your 70s or 80s.
Dr. Durrani, do you see this as kind of a reminder, particularly for men in their 50s and beyond across the country, to have prostate checkups? We can show some of the numbers we put together, over 300,000 new cases expected. It's one of the most common cancers of men. In fact, 1 in 8 men affected in their lifetime, most common cancer in men.
Yeah, 100%. This is a perfect opportunity to talk about that. If you are near your 50s, have that conversation with your doctor if they don't initiate it. There are certain groups, right? If you had a first-degree relative who had prostate cancer, you may need earlier screening. So keep that in mind. Certain races need earlier screening as well. And then never ignore any symptoms, right? If you're going to the bathroom quite frequently, if you have any pain with urination, you're not emptying constantly, and it's a newer problem for you and you're in that age range, tell your doctor about it, because the good thing about prostate cancer is if it's caught early, it's very treatable, curable, and it's something that you can obviously tackle and then live your life on.
Great insight and a great tip. Dr. Owais Durrani, thank you for joining us today.
Thank you.